Yeah, well, welcome to our Pettenkofer Talks, how to start a career or build a career in global health. We are really happy to have Ilona Kickbush today for our format, which is quite new. We had one session already half a year ago with Dr. Andrea Mon. And this format is organized by the three of us. So it's Mike Rüb, who is research assistant at the Pettenkofer School of Public Health in Munich and also a doctor in psychiatry at the LMU in Munich. Maike Voss, who's currently leading the development of a think tank at the German Climate Change and Health Alliance. And me, I'm a doctor as well and vice chair of the German Climate Change and Health Alliance. And today we have the honor together with you to get a glimpse or a little insight into the career of Professor Dr. Ilona Kickbush. And I will come to your CV in a minute, but first, why are we doing this kind of format? So our goal is to show young professionals and students how they can dare build their own career in global health. As especially in Germany, it's quite a new field. It's not always that obvious which steps you should or could take as the next one. And yeah, for the housekeeping, I'll hand over to Mike.
Yeah, thank you very much. Warm welcome also from my side. I'm very sorry that we can't meet in a very nice living room with comfy chairs. We asked for it, but World Health Summit couldn't provide it. So imagine we are sitting on a nice sofa with a cup of tea. So housekeeping, you can participate here in the room later via using the microphones that you please don't touch. We were instructed to tell you that. But you can also, and also the people at home, participate via Mentimeter, which is a platform where you can send questions and also rate questions that are answered by others. You find the link and the code here. You have to put in this 57 code, and then you can send in questions. You can start immediately, and Sylvia and I pick them up when they fit what we are talking about. But also please tell your story using the microphones here in the room. In the end, we ask you to stay maybe 1 minute longer because we have a small evaluation also via Mentimeter, because we want to improve what we are doing here. We also plan to have another Pettenkofer talk around the time of the Munich Security Conference in February. So please watch out for announcement at the Pettenkofer Talks webpage at the Pettenkofer School LMU Music, or also follow us on Twitter, and then you can see what we are up to. So I give back to you.
Okay, I'll do a short introduction of your vita, Ilona. I won't be able to tell everything because I think then I would talk for 30 minutes at least. So it's just a short introduction because you're so well known in global health. I think the global health wouldn't be thinkable without you actually, and all the achievements. You're very well known in global health circles and far beyond for your academic achievements and your contributions to the work of the World Health Organization. You got educated quite internationally, I would say, in Germany and India. Your father had been a diplomat, so moving was quite, I think, kind of normal for you from an early age on. And then for your studies, you came back to Germany and you studied something that you wouldn't guess, I would say, seeing the career you already achieved. So you studied librarianship, so something completely different. And first, after your studies in librarianship, you came to political science and you developed this interest for poverty, politics, and justice and women, because I've seen you wrote your thesis, your master thesis, and also your PhD on these topics. And then afterwards, you started your first job already at the WHO in 1981 in Copenhagen, which led you then also to Geneva. And you've been the first and the youngest and the first female director of the WHO Europe for the Department of Lifestyles and Health. And then you also been to Yale at the Global Health Division there. And also then you returned back to Switzerland. I already said that you had several academic achievements. So you developed several concepts like, for example, health literacy, health in all policies, but also you instigated the Ottawa Charter for health promotion, as well as the WHO's Healthy City Network. So really such like a great variety of different topics that are all touching on global health. And currently, you're part of the WHO Independent High-Level Commission on Non-Communicable Diseases, the WHO Global Preparedness Monitoring Board, and also the WHO Council on the Economics for Health of All, and recently also more into the topic of digital health, as I've seen. So this is really just a short glimpse. If anybody's of you interested to get into more detail, just follow up in this next minutes, because I hope we will get a little deeper insight, and also, yeah, you can read it up. Yeah.
Thanks, Sylvia. So we prepared some questions, but I think we will take it from where we go. Maybe we start with your personal background, and I have a short question that may lead to a long answer, but how does a librarian become one of the most influential academics in global health? How did global health come to you, or was it the other way around?
Well, that's, I think, very, very difficult to answer. But first of all, thanks a lot for inviting me, and very nice also to know that I'm following on Andrea Amon. We, a couple of weeks ago, had a lovely breakfast together in Stockholm, trying to cook up some things together. Well, you know, each person has their own personal history, and you try, I think, or at least many of us try, not to do exactly what your parents did. And my parents had two daughters. My father died early on when I was a teenager. My father was an economist and a diplomat, and my mother wanted me to become an economist and diplomat. So obviously I said, no, I am not going to become an economist and diplomat. I always loved literature. I continue to love literature. And I said, I want to do something with literature. Now, those were the days, you know, I'm reasonably old, that when you had career advice and you asked, you know, I'd like to do something with literature, nobody told you you could be a professor of literature. So they definitely didn't tell me that, and I didn't understand, you know, the academic system well enough. And so people said, you know, those that advised me said, we know a really nice job for you, which would suit if you want to do something with literature. You could go be a librarian. And that actually intrigued me because, and the more I did it, the more I liked it actually, because it brought together literature on the one hand, and the need to do and organize something on the other hand. But the first big question was, you know, do I become a scientific librarian in a scientific library or a public librarian? And to be quite honest, my grades weren't good enough to become a scientific librarian. But the public librarian actually really intrigued me. And later on in my life, I actually, you know, you sort of look back and try and construct your life. I thought it very interesting because I came to be to be trained as a public librarian. That was the later 60s, and you know, I sort of fell into the student movement straight away. Actually, in Stuttgart, there was a students' movement, and there was a legal requirement that the library school have a student representation. And before I knew it, I was the head of that student representation. And we started a political movement asking the question, how public is the public library? Because would you believe it, the kind of things they discussed in those days, whether, you know, what kind of literature should be in a library so that people don't loan out any trash kind of thing. And so we became a movement to actually say, how can libraries become more accessible? How are libraries really there for people? And in parallel, I became active in the students' movement. And then after finishing my library training, it was 3 years, I went to the University of Stuttgart. I got a fellowship also to study political science, because I said, what I really want to understand is politics. And from then on, yes, I did I did political science. But the next thing I knew was that I was at the University of Constance. And those were the days when, there was a lot of discussion of a lot of different political theories, etc. But at the University of Constance, a professor called Frieda Nascholz did the very first analysis of health systems. And that's how I came to health. And
so a female professor brought you there?
No. Frieda Nascholz was a male, definitely a male professor. And but I also had the opportunity, and here it was very helpful. My life is full of chances and opportunities and strange things that happen. A professor had just come back from the United States and was looking for an assistant that spoke good English. And so I made it because I'd been to a British boarding school. And we developed first ideas around consumer-centered healthcare. We translated the most important book on poverty in the United States by Francis Piven into German. So it was a very, very exciting time. And because of that, I sort of came to health. But just two more things, and then you can ask more questions. Coming to health was also because from the very start, I was part of the women's health movement. Well, I was part of the women's movement, and the women's movement anyhow was very much a health movement. We built up women's centers. We helped women travel to the Netherlands at the time to have abortions. We were very, very active. I was also the instigator of opening a political bookshop in Constance, which actually still exists. So for me, and I think that's the story of my life, it was always a mix of doing academic work, of doing political work, and of creating something, of setting something up. And I think everything I've done has sort of been a mix of those things. And all of that was finger practice for what happened in global health afterwards.
Thank you very much. I think a lot of younger people that are engaged in some kind of movement, be it Health for Future, or be it, how do you translate BMVD, the Federal Medical...
German Medical Students Association.
This one. I think this is also a place where a lot of young people get politicized, and I hear this from you as well. So that's, I think, something you relate to. Looking back at your career, what do you think, at which position did you have the greatest impact? What was maybe the most fun? And also, what is something where you think, okay, it's not so bad that it's over?
Well, actually, for me, often that's come together, the impact and the fun. Mm-hmm. And actually having an impact is fun because it makes you feel really good. And it gives you the motivation and and the strength, actually. Well, let's try the next thing. This one worked. Why not try that? I mean, it's very difficult to say. As I said, I loved setting up things. I loved the work in the bookshop, and it was also, hard training because this was the time of the Rote Armee-Fraktion, very, what in Germany is called, the Red Army faction, a very radical, some say terrorist movement. And, we had tough decisions to take, like, should the books of the Rote Armee-Fraktion be in our political bookshop and things like that. We had, discussions forever about that. We had discussions, should normal people actually come to our political bookshop? And we decided yes. And so we became the best bookshop in Constance for children's books and for socially oriented crime novels, because I had specialized in my librarianship on children's books, and I just loved crime novels. And I think, the people who delivered, these companies where you order the books kept wondering, what's happening here? What's this bookshop that's ordering all these things? So already then, having fun and having impact meant that it shouldn't just be a small group of people. And but actually, that you wanted an interaction, and the same applied, for the Women's Center. It shouldn't really only be for, women who were in academia, but how can we reach out to other women? Now, what really, for me, in terms of impact, of course, I got the extraordinary opportunity at the World Health Organization. I got a phone call one day, and I thought somebody is having a joke. Here is the World Health Organization, and I was called by the person who was responsible for maternal and child health for the regional office in Copenhagen, and they wanted somebody to do a study on the women health movements in Europe, and what that would mean for the work of WHO, what the major issues were, etc. And that, of course, was very exciting. I had already published some things in Germany on that, whereas I must say in brackets, there was a very political discussion. Is one allowed to publish on the movement? Or should one only be in the movement? Mm-hmm. So anyhow, that got me the attention of the WHO, and I went to my professor and said, I have this offer, I'd like to go to WHO. And he said, no, I'm not going to let you go, give you, I wanted 3 months. They said it would be a 3-month consultantship. And he said no. And I decided to leave. And actually, I was so aggravated that I didn't even, check exactly the best time to hand in my resignation, because I lost my Christmas money. But I just thought, no way. I talked to him afterwards about that, and he said, and that was very interesting as my mentor, he said, Ilona, I felt very much you had to take a decision, and this is one of these points. And you needed to take that decision, whether you wanted to stay in academia. I was a research assistant there, or whether you want to do something that has more policy impact. And that's basically the decision I took. And then I had a heck of a lot of fun because, Halfdan Mahler asked me to develop the Ottawa Charter. I was able to create projects like the Healthy Cities, and I always told my friends, I'm much luckier. My colleagues in WHO have to go and visit ministries of health, and they're usually the most boring buildings that you can find in the capital. Whereas, I went around Europe visiting these wonderful historical town halls and speaking to city parliaments and things like that. So those were very, very exciting times. And of course, over your lifetime, you then start to play a different role. Sometimes, it's more in the forefront, sometimes it's more at the back. I've always wanted to change things. And so I have the most fun while I try to change something. And I'm really happy if I've managed to pull something off.
Thank you very much. There's so many things I want to pick your brain on, but maybe speaking from a personal point, even though we have never formalized it, for me, you were always a mentor, because when I was in public health, in my public health studies, I read everything you have written because it was part of what we had to read, Ottawa Charter, Healthy Cities, you just mentioned it. So and you said something about your mentors in your career. Maybe you can look a little bit on what did they provide, of what kind of advice did they provide for you, and what would you also give advice to the people here in the room and in the online audience?
Yeah, I think there's several things. I mentioned, my parents had 2 daughters, and I had a wonderful father, and it was never a point to say a girl can't do something. So, when I had these discussions with my father, particularly when I was sort of 13, before he died, he just, gave me this feeling, actually, the world is open, and try anything you want. And so I think, that was perhaps one of the most important messages that always stayed with me, even though he had died. Then I must say I had professors who were incredibly supportive, and sort of I had these professors in parallel. I was doing all this women's movement stuff, and those professors, my professors, I never had the feeling that they were discriminating against me. They gave this advice. That's why I was just shocked when Professor Badura said, "No, you're not going to go." And then later I understood that probably was the best thing he could have done. Then it was very difficult in WHO because there were no female mentors around, full stop, the end. Then I was incredibly lucky because I was able to get the Director General of the World Health Organization as a mentor and his key advisor. And that was just an extraordinary experience, learning from them. There was also an important experience for me because I did want to make a career in WHO, so I applied for a director position. I was asked by the then regional director to be acting and manage the department. But then he decided that I didn't have the right leadership style. I don't know quite what that meant. And he said I wasn't ready to lead the department. That was quite a blow. And then he brought in a person who became one of my most important mentors. So then a Swedish colleague came in as a director, Dr. Ove Petersson, and he really became my mentor, my supporter, and gave me a lot of good advice. And then after he left, I applied again, and I actually got the position then as the first female director. If I look back, it was probably I wasn't ready yet, if I'm honest, and it was actually quite courageous of the regional director to ask me to be acting. So in a way, some of the things you see as a drawback, or maybe even as an insult or something, actually then turn out to have been the right decisions by other people. And I had to concede that. And I must say, in terms of my immediate superiors, I actually never experienced within the WHO, my immediate superiors, I never experienced discrimination as a woman. Actually, it was the other way around, that they supported me. But I must say, from colleagues, from representatives from ministries of health, it wasn't always easy. And I mean, those were the days in the 80s where I think, some of the discrimination was quite extraordinary. And so on the other hand, I was never quite sure, because you must think of the fact when I came in 1981 to the WHO, I was 3 things. I was younger than practically everyone in the organization at a professional level. I was a social scientist. I was actually the only one in the Copenhagen office, and I was a woman, a young woman. an unmarried woman, and soon I was an unmarried mother. And so I never quite knew, if somebody discriminated against me or insulted me, which of these four things it was. Did this guy not like me because he's a medic and I'm a social scientist? Is it because I'm a woman? Is it because, as happened, then I got a senior position, and suddenly I was the boss of medics who were 20 years older than me. But I couldn't always place it, and maybe that was good, because it was also, in terms of my reaction, maybe it was good that it wasn't only, oh, they're discriminating against me as a woman. It's really, they don't like the whole package. And so I think that helped with my responses.
Yeah, I think you touched already on a topic that we would like to go on with now. So we talked about the personal background and your career path, and now let's go to more the work and health balance and gender equality topic. So you said, like, back then there weren't so many female mentors, but when you look at the numbers, especially from the Women in Global Health, they still show that 75% of the people working in the healthcare sector are female, whereas only 25% of the leadership positions in the healthcare area are held by females. So there's a huge discrepancy. So two questions to you. How can we support young female women to get into these leadership positions as one point, but on the other hand as well, how can we encourage men to enter more positions in the healthcare sector?
Oh, well, that's big societal
because
change,
it's a
isn't it?
two-fold problem, no, isn't it?
Yeah, I think, Mia, maybe we focus too much on the first and less on the second question. But yeah, it was the same thing. And actually, to go back to my librarianship days, that was the first thing I noticed when I worked in the libraries, that all the librarians were female and the bosses were men. And then, I studied that, and it turned out that all the men had PhDs and the women didn't. And that's when I decided I needed a PhD, because initially I still thought, I was going to lead a library and I was going to run this revolution in the German library system. So I think, one of the things is, first of all, women who do make it should support other women. It's as simple as that. And it's not only the women coming after you, it's also the women next to you. And it's the women, let me be simplistic, above you, because all of them are under special pressure. And so, how do you also generate a kind of a solidarity, or at least a network, or things like that? And I think every single woman should be active. I think young women should seek out mentors. You don't just wait around until a mentor comes along, but you say, who would I like to have, and approach them. Also, to be aware that not everyone then might have the time at that point in time, because, being a mentor is something one should take seriously. And so a lot of it is about giving support, but on the other hand, it's also at the same time being, respect going both ways. One story that's always stayed with me, because I was so angry, was I had a young woman working with me in Copenhagen. And at one stage, she came to tell me, how dissatisfied she was with me as her supervisor, etc., etc. And so, we got talking, and I started having a bad conscience, and tried to find out all these things. And then she literally says to me, you would be a fantastic boss if you were a man, but as a woman, you're not good enough, says this young woman to me. And so, I tried to understand that. And she sort of meant that as a woman boss, and that, you know, fell into what I thought were all these Vorurteile, that, yeah, she said, you have to be more empathic. You have to understand me more. And I said, but, you know, as maybe your mother should do that, or your best friend, or, you know, or your mentor, but, you know, I'm your boss. And I'm the first to give you compassionate leave if you need it. Yeah, but so, you know, these kind of things are quite tricky, because at the same time, it was important feedback, because, you know, you want feedback from your staff and from young people, and particularly young women. But it's a thing like I never really understood. In terms of a young woman that wants to make a career, I mean, for me, I never planned my career. And which is not, I'm not saying, you know, you shouldn't plan your career. But for me, it was a whole range of things. I mean, once I was in WHO and there were no female directors around, I said, well, you know, I'd better be the first. And it worked. Then there had never been a female regional director before. So through a whole lot of happenings, I was candidate as regional director. I didn't make it for a number of reasons. But again, you know, then I felt I'd been WHO long enough. I should go back to academia, and I went to Yale. And then I didn't like it in Yale, and then I came back. So, you know, I think it's important to say, and it comes back also to your fun point, you know, what do I want to do? What do I want to achieve? But how do I want to live my life? And you know, I understand myself to be an incredibly privileged person. And I try usually not to complain, because, you know, I am incredibly privileged if I look at my life. And therefore, if there are tough decisions, you know, I say to myself, or I said that in the past, you know, I felt I had to leave WHO, and I handed in my resignation. I didn't like it in the United States. I left a tenured position at the Yale University. And I said, you know, if anybody has choices, it's somebody like me, and I have to take the risk. If I feel, you know, I can't live my life as I want to live it. And so just, you know, as a piece of advice, have a career plan, but never forget that you have to live a life. And that comes back, you know, to the fun bits, to all kinds of things. And never forget, you know, obviously, you need to have time for your family, or if you have children. I have a son, and he actually taught me, just by being there, how to organize my time. And then, you know, and always make time for your friends. That is really, really the most important thing. And if it is, you know, writing it in your calendar, but if you don't, you know, ensure that, because it's still tough to be a woman in this business. And to this day, you know, I'm sometimes discriminated against. So, and then, you know, you can say, is it because I'm a woman, or because I'm old, or because of what? But I think you always need, particularly if you want to climb certain mountains, you need a social support system. And you have to, you know, as stupid as that term sounds, you have to invest, you have to work on the social support system. You have to be there for your friends, and then they'll be there for you.
Actually, that already answered my next question. So turn it around a little bit, because it's been like, how do you reconcile your family and working life? But I think you already answered that. So it's sometimes it's easy to say that looking back, but when you're in the situation, you feel like overwhelmed, everything, there's happening so many things, and it's quite tough to remember in these situations, okay, yeah, I'm not stressing out myself, I'm now going back to my social support system. So how did you manage it in these traveling situations to stay kind of healthy, calm, and make the right decisions?
Well, I think part of it is personality. I'm not, I don't get excited very quickly. I don't get frustrated very quickly. I can explode and then I explode and then it's over. I'm not trying to say, oh yes, I've lived this wonderful life and I've done everything right and I always had the right work and life balance or whatever. In no way, it's things that you learn. And again, you need support. I needed support to bring up my son. So, I had to hire people to do that. I had to find the right relationship to these young women who were helping me, and also helping them to take the next step, because for many of them, it was young women who then wanted to go on to university or something, and to advise them on their careers and not just see them as a babysitter or something like that. There are definitely times when I worked much too hard. And I didn't have a choice, when we were preparing the Ottawa Charter or things like that. You do have to work around the clock. On the other hand, what can I say? I love what I do. And so I never quite understood this work-life balance business, because, work is part of my life. And quite honestly, and this is the discussion I always have with my partner, that at one stage he felt I should do less, and then he sort of had the big revelation that he'd probably hate me if I were doing less, because I think I'd be much less of a nice person if I had nothing to do. So it's these ups and downs, and but you do learn some coping strategies, and then and obviously, since I was involved in health promotion, I try to apply some of the principles about physical activity,
which is not always the easiest still, I think.
No, but I belong to the school of thought that sort of says every set of stairs that you walk makes a difference. Trying to keep activity in every day. And then, there's a principle I introduced for myself in terms of traveling, that I always try and do something culturally. So before I travel somewhere, I look, what's the exhibition calendar, what's the opera program and things like that. And then, I, instead of, sitting around in hotel rooms in the evening, I go there. And obviously, the privileged situation then obviously comes in, because, yes, you do have to take a decision on where you spend your money, but then my decision would always be, give me an opera ticket. So those are the kinds of things. But, there have been really tough times, absolutely. And I'm sure if you put Julian here, he could tell about times.
Can someone get Julian, please?
He could tell about times when he didn't see his mom as much as he would have liked to. And so I don't want to idealize anything. There's really tough decisions you have to take at certain points in time. There are times when you'll have an incredibly bad conscience. All of these things happen. But that's also when you need to have someone to talk to and be able to work it through.
Thank you a lot. I see a lot of questions coming in, but maybe we can tap on the blog that we have prepared on competencies of young professionals in global health. what do you think is a skill set you can work with in your day-to-day work that young people should bring or build on, competencies wise?
Well, I think if one is in global health, this understanding of what I have called health diplomacy is very important. In general, I think in these kind of positions, if we say, global health, either, on the development side or on the global health side in terms of international organizations, etc., you need to be able to communicate, you need to be able to have deep respect for people, for other cultures. And for me, it's actually was defining that I grew up in India, that, that gave me a base where I hope I have, always looked at colleagues from other parts of the world as equals, because I grew up with them. They were my friends, so I think, those social competencies are incredibly important, particularly now when there is all the discussion around decolonizing global health, etc. Again, particularly people with our skin color have a special responsibility, and we need to think about that. I think, an analytical capacity is very important. Understanding context is absolutely critical. I think one of the reasons I had the career I did was because I was a political scientist, and one of the few that was around. And so I also, could bring something to the table that other people didn't have. But I think in general, the whole field of development of global health, of working in international organizations, of multilateralism, actually means having a deep respect for the other. And unless you bring that, I don't think, well, yes, of course you can make a career, because many people who don't understand the other made careers, and they're not necessarily my favorites. But I think it brings a lot of personal satisfaction if you can work in that way and take agendas forward. I mean, I think also you need patience. Adrienne Rich, a feminist poet, said something very important. She said, a wild patience has taken me this far. And I love that notion of a wild patience, just don't give up, have an agenda. And I was talking to someone over lunch today, and she was talking about, how global health had developed in Germany over the last 10 years. And I was, thinking of when I came back from Yale and was doing, I wouldn't know the English expression, Klinkenputzen, here in Germany and in Berlin, trying to tell people, hey, global health's important. And so you just stick with it. I mean, if you have an idea, if you have a vision, don't give up too soon. I call it a terrier quality. You just do it again and again and again. And if you're lucky, some things work.
Maybe one final question before we open up for questions from the audience. With your experience from the last decades, what are currently topics where you think more research needs to be done? So, or in other words, where young professionals can be interesting for young professionals to specialize into these directions?
Well, some are new, some are old. I mean, I think particularly, the whole equity agenda is so absolutely critical, and everything that relates to that, and the new kind of expressions of inequalities that we're experiencing in our society, this just won't go away. And more at a contextual level, of course, the enormous power imbalance in global health, in multilateralism, etc., is a key issue. And I see that both, you know, as a political agenda, but I also see it as a research agenda that, you know, where the two to some extent would come together. I do think, you know, research on how political decisions are made is really, really important. And we've seen that in the COVID pandemic, that we know much too little about that. I think how trust in our societies are generated is a real challenge. And so I think there's a whole range of arenas that still need to be researched, but probably the most important is that we start doing much more interdisciplinary research. I mean, the step that Maike has taken to planetary health, to the interface of, you know, different disciplines coming together and working together. I think that's really the challenge, and that's, you know, what we should be doing and trying to take things further. And that also was a little bit the idea behind that Berlin Hub for Pandemic and Epidemic Intelligence, that, you know, we wouldn't only be doing surveillance and epidemiological studies and surveys, but really bringing the other disciplines in, learning from climate science, from weather research, from all kinds of things. And so I think, you know, developing the creativity around that, new kinds of interfaces. And then, of course, we launched yesterday the report on governing health futures, which is very much about the digital transformations. And I do think we need to learn and know much more about the digital determinants of health, the whole way, you know, our world is changing through these digital transformations, the new inequalities emerging through that, and many of the ethical issues that come from that. So, I mean, the research agendas are like this, and they're very open, and I think basically everyone can find a place. And again, here, you know, one should be insistent and take risks to maybe establish a field we don't even know exists today. So just, you know, think about it, take it forward, and you know, at first instance, it's always difficult to get grants in areas that nobody has thought of before. But then the mentorship comes in, and, you know, and the risk taking.
Thank you very much. I take it as a compliment, my change in careers.
An absolute compliment.
Thank you.
And, you know, it's also the risk taking, building up something new. I think it's fantastic, and congratulations.
Thank you.
And I think actually to add on it, for actually climate change and health, that's been especially like exactly this kind of topic where 5 years ago in Germany, everybody was like, what is this about?
You know, I'm incredibly proud, if I might say. You know, I don't know, most of you weren't born when we wrote the Ottawa Charter, but the fact is the Ottawa Charter was the very first WHO document that raised environmental and climate issues. If you look at the 5 action areas, the supportive environments, we use the term ecology at that point in time. And I'm incredibly proud. I actually wrote the very first paper on this stuff. It's called Good Planets Are Hard to Find. And it was written in 1988. That was one of the issues that nobody was interested in. You know, these things happen. And so now I'm really very happy that a new generation has taken up all these issues, and I just celebrate it.
Thank you very much. I hope you took notes of all the topics that Ilona just mentioned, because they will give you ideas for write your thesis on, for example. So I will ask you now here in the room maybe to start off with comments and questions. Just run to the microphones, take it and ask your question, and then we come maybe to the online audience. Yes, Annika.
Hi, thank you very much for this really inspiring talk. I was wondering because, well, I'm also a medical student, but on the side, I'm an activist in the abortion movement in Germany. And you also talked about this at the very beginning, that you, like, some time ago, you were also involved with like the women's health movement and everything. And I was just wondering, as you like have been so long in this area, and a lot of things have changed and have improved, but a lot of things have not. And especially when it comes to abortion in Germany, for example, we are still fighting in 2021 the same fights that like women like you have been fighting for so many years. And I'm wondering, like, what are your thoughts on this? Like, does it motivate you to see that there's still young women, but or does it also like frustrate you to see that there are still areas that have not changed at all? And I mean, abortion is just one example, but I guess there are so many more where there's young women like us who are still fighting the same fights that other women have been fighting for so many years. And yeah, I was just wondering, what are your thoughts and ideas on this? Thank you.
Thank you. Well, it's quite simple. As long as patriarchy exists, we have to fight these fights. It's, you know, that's just it. And, you know, patriarchy is not about any blame to individual men here in the audience. It's a structural system of power asymmetry. And therefore, you know, until that is changed, until we really have societies that are, and, you know, I'm not saying we should now replace it through a real matriarchy, you know, until we really have a society where we respect each other and one gender doesn't have more power than another. And also, you know, this thinking that is so much further than in my own days about a much wider range of diversity and sexualities, etc. I mean, for us, the world was relatively clear. There's women, there's men. But, you know, it's not that clear, and that's good. And so I think, you know, that's the situation. That means, you know, I don't know how it sounds, but the fight has to go on. And also there's rollback, you know, there's regular rollback from patriarchy. There's you know, the whole issue, if you look at some countries, also in Europe, what is happening there, and you know, the symbolism of the Handmaid's Tale. So I think it's not over, and it's going to continue for a long time. And I think, you know, one really important thing, of course, is to get more women into politics, and more women who want to fight for women and their rights into politics. And there's a tiny increase I saw in the German parliament now, very small, but still, you know, actually interesting, though it's no guarantee, because we had elections in Switzerland 2 years ago with a lot of young women coming into parliament, and they have not been able to have an impact so far, which, you know, is probably a question also of experience, of, you know, how you influence the system, etc., etc. So it will need a longer time. But, you know, it was quite good if you see what the women of the Social Democratic Party did, you know, insisting on a senior position. And let's see what Olaf Scholz does in terms of the distribution of ministries. I think, you know, these decisions are taken, many of them are taken at the political level. Of course, there's always an, in quotes, cultural dimension. What do we accept? What role does religion play? All these kinds of things. But in general, you know, we need laws. We need laws that guarantee rights, and that, and then, you know, we need a movement, a continuous movement that ensures that the rights that are enshrined are actually ensured and implemented and made accessible. So it's that constant thing. But yes, of course, you're frustrated if, you know, sort of you're out there in the streets in 1968, and then you look around in 2021, you say, my God. And I mean, that was one of the backgrounds when I had come back and suddenly realized, you know, I keep being the only woman on these panels. And then some of you might remember that I started that Twitter campaign saying, you know, there's loads of women out there. And yeah, and it led to something, and Rupa turned it into a movement, and that's fantastic. So, so on the one hand, yes, frustration, actually anger, if I should say. I tend not to be frustrated. I tend to be angry, and then at the same time, I usually then say, well, what can I do about it? And then I try something, and some things fly and some things don't. But yes, no, you will have to continue. No optimism there in that sense. It's a constant move forward. And I think it will still take time until we have a different social and political system that really has women as equals.
Yeah. Just go to the microphone.
Good, sorry, tall for me. Good afternoon. My name is Casimiro Vizzini. I'm the Secretary General of UGLO, the European University Alliance for Global Health. Actually, I was interested about this gender issue because it's, of course, it's a topic of global health. But the point that we are not focusing that, I mean, the old discourse of girls should be active and they have to fight for, no, everybody has to fight. Not only girls. Preaching to the converted, it's not useful. And this is the old feminism from the 60s, I'm sorry to say. We have to bring on board men. It has to start from men. Global health is an issue also on that, because it's a gender-related issue. But you have to educate young boys to be feminists, not just preaching. You know, I was in UNESCO before, working in the science and in the natural science sector. Actually, I had a career in let's say, global health, if you want. And we were organizing these meetings about gender issues in science, women in science, blah, 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 full of women. Fine, very nice, interesting women, and this the topic of women in science. Where are the men? This is the point. This is a real point. A real fight is a fight that is brought for everyone and from everyone, not just from women for women. And this for me is extremely important. And laws are important. For example, you call the Prime Minister Merkel. Is it her real name? Is someone fighting in Germany about the family name? You still bring the name of your mother, of your fathers and your husbands. And that's, for you, is normal. In Spain, it's forbidden. Many things like this. I think that the old feminists from the 60s did its time, but it's now time to change. And the new feminist has to be everybody on board for global health.
Well, you know, what can I do? I'm an old feminist from the 60s. I mean, I can't change myself. So that's the first thing. The second thing is, I think I'm very proud that I have educated a feminist, and those of you that know Julian will know that. And I'm a mentor to many young men, I might say, and this is not, you know, so, oh, I want to sort of defend myself. But I still think, you know, if you want to achieve something, yes, women need to fight. And I wish, you know, many young men like you would fight with them and for them. And a little bit what you said sounded like, you know, that the women continuously come to you and say, come and fight with us. I think nothing, I haven't, you know, in the early 60s movements, we didn't let men in. And there was a reason for that at that point in history. That doesn't happen today. We have meetings and the men just don't come. So please, you know, come to the meeting and bring 10 other guys with you. And everyone is going to be really, really happy you're there. And you know, this is one of the really intriguing things for me, that in everyday life, you know, if you look, I find it wonderful when I'm out on the street and I see all the guys with prams, etc. In my day, you know, that was a revolution. So, you know, those kind of things have happened. But on this, you know, political and particularly also in science, it hasn't happened yet. And, you know, I'm waiting for the guys to complain in their universities, you're not appointing more women. I'm waiting for you to do that. But it's not, for me to come and say, please, go to the president of the university and argue as a young man for more women. So I think, I know where you're heading, that it is not, and it is a societal issue. And, just like, let's say, socialism, people trying to change a system. And the more men that are active to disrupt and to get rid of patriarchy, great, come along, guys, we're ready. So thank you for that contribution, but I do think some of the things the boys need to do themselves. And I think in terms of the pressure patriarchy itself puts on men, I'm really surprised not more of them, try to say, I don't want that, thank you very much. There is change, we were talking last night at one of the dinners about, what people expect from work, for example. And if one talks to young doctors nowadays, they're not willing, to do the kind of extreme workloads that for which you need a housewife at home and things like that. So things are changing, but the structural system itself hasn't changed. And if there is solidarity for such a fight, all the better. I couldn't agree with you more on that. But I guess I am a 60s feminist, and there was one thing that was good about that. We saw ourselves as a movement, and we put, if we put blame, we actually, maybe we were simplistic, but we didn't put blame on ourselves. We put blame on the system. And one of the things that really worries me at this point in time, that so many young women put blame on themselves. And, because then the picture is put, if you only want, you can reach anything. And you can't, because of the structural system. And so in some cases, some things were easier for us because we're simpler. And of course, every generation has to fight their own fight. But obviously what I say comes from my history. So
I would like to touch the question on mentorship again, because it came up in the Mentimeter questions as well. And with the comment on, there are many programs, especially from people from the Global South, but when you're not from the Global South, it can be harder to find a mentor. So the question had been how do we find a mentor? But I would like to broaden the question a little bit, because I think this question about mentorship is not only about how do I find a mentor, but it's more also about where do I get ideas, where do I get inspiration, and where do I get the courage, maybe also sometimes, to make the decisions for my life that will change my life in the direction. So yeah, maybe you could just touch briefly on how to find a mentor, but I'm more interested in where else did you get inspiration and courage for the things you did?
Well, I mean, on the one hand, you always watch people. And, I think every one of us has seen people say, oh, I'd like to be like that person, or, that's a goal I have. And in some cases, it's the person, in some cases, it's the position, it's that. So, that's one thing. I mean, role models are always important. And for me, role models were both men and women. So, that was always a mix. I think, having some kind of idea who you want to be and where you want to go to. And I think you can never find that only alone. I mean, you do have to reflect, obviously, but the more you can discuss that with other people you trust, and that's really important. I think sometimes too many people try to resolve things on their own. And to some extent that needs courage, also to go to somebody and say, I'm insecure, I'm unsure, I don't know what I should do. I have to take these tough decisions, and I would really encourage you to, and it comes back to this friendship thing and mentorship thing, to find people with whom you can have that open dialogue, because at so many points in time, that is important. And, you know, that can be a life decision, but it can also be an insult or something, because my experience is if you don't work something through, it sort of stays with you. And it hurts again and again and again. And so I hope that's some kind of answer. I think the most important thing is really don't try and resolve that alone. And of course, that means, as I said earlier, to be sure you have a home, in a sense. It can be a movement, it can be a set of friends, it can be your family. I mean, in a group like this, Gro Harlem Brundtland was interviewed, and her answer was to young women, find the right husband. And everybody nearly fell from their chairs, you know, said, what? Gro Brundtland is telling me to find a husband? But, you know, she was trying to make the point, you know, try and find a partner in life who respects you, who lets you live your life, who supports you. And so those things are really, really critical. And, you know, just to go off side a little bit, something that's always worried me, if you look, and maybe comes a little bit to your point also, it's interesting that, you know, these dating sites do these analyses, who's looking for whom. And it's very clear from the dating sites that women are not willing to meet with a man who has less education than they have. So, and, you know, the very least women will do is to look for somebody who's at exactly the same level. And actually, if possible, they try to look for somebody who's one step up. And I think that tells us something also about power relationships, how we understand them and live them in our everyday life, and what perhaps also we women have to think about a little bit, who we share our lives with, you know, what power relationships we have in our relationships, and what maybe we need to overcome from, you know, the long time that we've, you know, men have been, you know, the breadwinner, or, you know, whatever.
Maybe we have time for 2 more questions, but thank you for deconstructing the algorithm of online dating. I find this quite fun and correct. So I think I'm just looking at the ratings. There's a question: as a junior doctor thinking of leaving clinical medicine for a career in global health, would you say there is an added value in having a medical degree in the field of global health? If yes, how so?
Well, I think we need everything in global health. If I think of this incredibly important movement of surgery in global health, I mean, even I asked at first, what are these surgeons doing here? And it's so important, you know, surgery in primary healthcare settings, absolutely critical. So, you know, I just want global health to be incredibly interdisciplinary, and that each discipline respects the other and understands what each of the disciplines brings to it. So definitely, you know, bring the expertise in clinical medicine and make it useful. Absolutely.
One more question?
One more question. I think the $100 million questions is the question that was raised on your 3 recommendations for us here in the room. Or maybe with a smile on my face, what would you want us to make better than you did?
Well, that's really difficult as a question, because you know, the time was so different. The lifelines are so different. I mean, in terms of lifelines, some of you could be my children, some of you could be my grandchildren. So it's very, very difficult to answer it in that way round. I think, you know, this one thing that I said, you know, reflect what you would like to do and try and do it, and make an analysis. What does it need that I can do it? I think the other is be true to your dreams, you know, do take risks. And again, you know, look at us here. I come again with this privilege, you know, compare yourself to a similar group of young professionals in Addis Ababa. You know, we have choices. And because we have choices, we have responsibilities. And it's such a gift that for our lives, we have these choices. It's an incredible gift. And therefore, I must say, I'm sometimes a bit impatient if, you know, people complain about their life situation, but at the same time are not willing to take the next step of the risk. And, you know, I'm not asking you to throw your family into poverty or something, but you know, really that balance. And then I do think coming back, you know, be a good colleague, develop friends, and never try to just be yours, you know, me doing this. And wherever one can turn it into us doing this, I suggest you try and do that. In that situation, then maybe you're the best communicator, and then people will say, you know, please be the spokesperson. Yeah, so these things will develop, but always try and move from the me to the us.
Maybe one final question from the Mentimeter we have. When now sometimes you have to make certain decisions, and you already have like the perspectives from both areas, academia and political work. Who has more impact? Or more important impact? So scientists or politicians? Because as scientists with little political knowledge, we feel sometimes helpless, it says. So what's your impression? Who has more important impact? Or can they have both like an equal important impact?
Well, we know from the COVID pandemic how, you know, both have an enormous impact. And you know, for me, it was very intriguing. Some of you know, we opened the Berlin Hub a couple of weeks ago, and we had Katalin Kariko with us, who, you know, contributes incredibly to the development of the new vaccines. And you know, there was an introduction situation, and we also had the head of CERN with us, also a woman, and people were introducing each other, and she said, well, this is Katalin, she saved my life, you know. So in a way, it's also hard to judge, you know, what's the influence. And so I think science makes an incredible difference to our lives in so many ways. And politics also makes a big change. In the best of all worlds, as we've seen in the pandemic, they affect something if they work together. But social movements have a tremendous impact. So, you know, and that leads us a little bit, you know, even to the World Health Summit as a last word, to say, you know, there's all these actors in society, and if each of them showed their social and political responsibility and affected change where they can affect change, then it will be good. And then it's not about more or less. In some cases, we need political decisions. We feel we're lacking them now in global health. We were incredibly lucky that we had creative scientists that developed the vaccines, and we must all be thankful to them. We have the social movements fighting for the equity issue and the distribution of vaccines and the TRIPS waiver, and that's important. So I can't, you know, weigh it up like that.
We need all.
And we all need to act for this better and more equitable global society. And within that, global health plays an important role.
Thank you.
very much.
Yeah, thank you a lot. We know that you have to leave a little bit earlier, but please stay. We can continue talking about what we learned and heard today, but we want to say thank you with a book
Brand new
Sylvia
book,
will
Planetary Health. And
exactly.
it's the most important topic for the next decades.
Thank you very much.
You're
Thanks a lot.
very welcome. So thank you again for being with us. Feel free to rush out if you have to. And I hope we all can come back to you and talk about this book and about every other topic we raised today. Thank you very much.
Thank you very much for having me. Thanks.
So yeah, as Micah
Continue.
said, we like to improve our format. So if you go back to the Mentimeter, Mike will open 2 more questions for evaluation for our program. So what did you like? What could we improve? And also, whom would you like to have as a guest for the next Pettenkofer Talks in like approximately 6 months, half a year? And yeah, we also would like to thank Mike, of course, for the technical support and the Mentimeter here. Then also the Pettenkofer School of Public Health in Munich. Thanks for Eva Refus, Stefan Voss, and Brigitte Stravert, who also do the webpage and organizational stuff, logo and everything. We would also like to thank the World Health Summit, who made it possible for us to be here and also to talk to Ilona here, to have the venue, of course, to Jörg Heldman and Julian Kickbusch at this place, and to the German Network of Young Professionals in Public Health, the NUC, who also advertised it and who always supports us. Yeah, and we would like to thank you. Thank you for your questions, for your participations, and we hope that you took some inspiring thoughts from Ilona, and that, as Micah said, you noted everything down, wrote down, made notes, so you won't forget it in the future.
Yes, we are a bit early, so feel free to stay and to chat with us, with each other. Otherwise, see you where the coffee is.